So Karen, where are we at today?
We are at the Mountain Hope Good Shepherd Clinic, and this is the lovely Ashley, and she is going to take us on a tour. She is the Director of Development, and we're going to get an insight into what the amazing work they do here. It's all about.
That's right, at the Good Shepherd. So what's that Sue?
That's Sue, East Tennessee State University.
So it's not like a cold, like a chew.
Really? We have a wonderful relationship with ETSU. All of the medical students do a rotation through here during the third year.
Okay, I just thought that's how you spelled sneeze. That's
fantastic.
Well, come on inside. Let's go inside and check this out.
Thank you.
So this is the reception then?
This is it.
Oh, look, that's actually quite a good reception. There's plenty of chairs.
It's a nice little area for the children to play up the back there.
Plenty of plaques on the walls.
Yeah. We try to keep it comfortable.
But tell me, are your magazines current?
Actually, they are.
Are they? All right.
That's always a good thing, isn't it?
All right. We have sports magazines for men. Sports magazine, very important. You should read that. Okay? Educational magazine. Why don't we go in the back and see what it's all about?
Okay. Let's go and have a look at the facilities, shall we?
All right, so we're coming through into the heart of the area. I really like this because when I have to go, this is my special room here. So while I'm in here, why don't you just say what's going on out here, hey?
Sure. Can you tell us a little bit about what you do here?
Sure. We are a medical and dental facility for folks who live or work in Sevier County who have no insurance. So if someone isn't insured and they have a medical or dental need, they can come to Mountain Hope.
That's fantastic. In this day and age in America, there's people that definitely need that, and it's a wonderful service to provide to people.
Well, I feel a lot better. That's good. How about we go through here? Now, what's through these doors?
This is our dental unit.
The dental unit? All right, let's go inside there and check that out.
Oh, this looks fantastic. What wonderful facilities you've got here. Are these fairly new?
These are. We actually were very grateful that Delta Dental upgraded our equipment this year.
So this is your dentist chair.
This is our dentist
This
chair.
isn't a massage chair or anything like that? Is this? Can I sit in this? Is that all right?
Absolutely.
Now, you're not going to turn on any drill or anything, are you?
That's not my job.
That's not your job?
How often does your dentist come in here?
He is generally here 3 days a week. His name's Jeff Clark. We also have a volunteer dentist who comes once a month or so.
And the facility relies a lot on volunteers, doesn't it?
Absolutely. We have 30 active volunteers.
Where's your squeezy bits for the chairs when I get the drill goes on? I got grab it on the something.
You know what, Randy? Their dentists are probably so good that you don't even need that.
Oh, that's really good.
So fantastic.
But listen, this is for when something actually happens. You can actually have your dental hygiene done as well. Is that right?
Yes, we have a dental hygienist on staff, and preventative is a huge.
Where do you do that? Is that in here? Is that?
It's actually a couple of rooms down.
Let's go take a look at that as well. That'd be great. Wow, look at all these toys. These are really good. Can you can I actually have somebody sit in the chair and can I try this out? I've always wanted to try this out.
I don't know if I'm comfortable sitting in the chair.
Serious? I'll be good, I promise.
Randy, that's probably been sterilized, so I think you should put it back.
All right, let's go and check out this other place.
Let's check out the hygiene.
All right, okay, here we go.
So you have a dental hygienist here too?
We do.
And that's great for the preventative care, I'm gathering, because you won't have as many emergencies if the prevention is done prior.
Absolutely.
How many dental hygienists do you have on staff here?
We have one. She's here 3 days a week.
Another chair. All right, this is it.
And this is where you need to be, Randy, so that you don't end up in the room up there.
Yeah, no, it's a good thing I really take care of my teeth. And I got more tools as well. Can I get one of these from?
No.
Serious?
And I'm gathering you have a fairly long waiting list for...
Dental hygiene, we are pleased that people are taking advantage of that. The best way to get in for a dental appointment of any kind is to give our office a call on Monday morning.
Do these give massages as well?
Wouldn't that be great?
It would be great. So they would call on Monday morning?
And we would try to schedule them for that week.
So they would normally get in with about a week's notice.
So how do you put the chair back?
We have quite a wait, and we often have to say no to people. Right now we have about 22,000 patients of record.
22,000 patients in need of your services.
Right, and those aren't all dental, but you can imagine the wait.
That's amazing.
So it's very important. Our phones roll at 8:30, and we try to take the first callers, so it's best people call in early.
Can I organize to get a football screen up there so I can watch a football?
You know, that might get more people in that chair.
Probably not.
But this might be a good time to make a note of the fact that you have local artists that have actually donated their artwork.
Is that right? Well, let's go take a look at that, because I can only sit in a dentist chair for so long until I start absolutely working out.
starts to get sweaty palms and feel really, really
But I didn't hear
nervous.
that drill sound, so that's all good. So let's go check out this next place over here. Where are you going?
And I believe that we're going to meet the lovely Robin here. So can you tell us a little bit about what she does for the clinic?
Robin plays a very special role at the clinic. When folks are prescribed medications that are very expensive, Robin acts as a liaison between our patients and the drug companies to try to get those medications donated.
That's amazing.
Is she in charge of the paintings as well?
No, but
Really?
we do have some local artists who have been very, very generous.
These are amazing. How did you get the babies? And do you buy the babies like that? Is that where the storks, the whole stork?
Yeah, that's exactly right.
Oh, that's down the road, isn't it?
Yeah.
That's it.
But so basically, if patients really don't have the money, they can get their medications.
A lot of the
free.
pharmaceutical companies make overstocks in order to donate them. But they require a lot of paperwork and they want background on the patient. So Robin helps with those things to try to get those medications donated. We also have a pharmacy here in the clinic where we do things that are pretty general, antibiotics.
So if someone comes in with a cold, they can walk out with or a flu, they can walk out with what they need to make them feel better.
Have you seen the painting down here? There's a bear with a fairy. You ever seen a fairy bear before?
No, I haven't. Let's go
pretty
down and have a
amazing
look.
thing. This is like a wall of art.
And this is the classroom here, is that right?
Before you go in there, now this is the local artist we were talking about, yeah?
Oh, right, yes, yes.
And he puts fairies in his pictures?
He does.
Yeah.
Hi, this is Mary Vance, our executive
Hello,
director.
Mary. How are you? I'm Randy. This is Karen.
Hi, Mary. Nice to meet you.
Nice
Wonderful work that's been done here.
Yes.
Yeah.
Are you a painter yourself?
Yes.
Yes? What do you think?
I airbrush.
Oh, do you? Is that right? I've got a car up
It's
front
been
that
a-
needs some airbrushing.
I
Can you do that?
know. It's been a long time,
Yeah?
but I
Shoot airbrush people's faces. I know some real ugly people that can use some airbrushing.
Randy.
No, seriously, it would help them out a lot.
well, airbrushing is used a lot for retouching photographs.
Oh, there you go.
It is. Yes, absolutely.
We just need to put it into, should take that into the teaching room
Classroom. Yes,
and
Yes.
check out the classroom and see what's in there as well.
because you have.
Thank you very much. Lovely.
So nice to meet you.
You walk with me this way and let them check out that.
Oh,
I'm going to go get airbrush.
Oh, you enjoy that, Randy.
you were
So
worried.
tell me a bit about the classroom here.
Oh, we're just taking
We're really grateful and lucky and blessed to have students from 15 different colleges and universities that come through Mountain Hope at different intervals during the year.
And you'd be lost without them.
They would be
here.
lost without them, and they do an amazing job. They get some training here. We get their hearts and hands for a little while. It's a great, great thing.
And a lot of them have actually gone on to become employees here.
Yeah, we have several folks here on staff that started here as students. We have a medical assistant and a couple of nurse practitioners who started here as students.
So great springboard for their careers.
Wonderful. Yeah.
And doing a good thing for the community.
They are doing a great job.
So you have staff members that speak Spanish?
We do. We have an interpreter who's here 5 days a week, and most of our front office staff also speak Spanish.
And for those that don't speak Spanish, you've got other ways that you can converse with them?
Absolutely. We have one volunteer who speaks some Russian, but in addition to that, we have a phone system that allows us to translate any language. So if someone comes in, we can actually point to a poster, ask which one looks like their language, and if they tell us it's number 47, we simply dial a number and tell them we need
And
number 47.
you don't have to speak number 47.
That's right.
And these are where all the surgeries are here, and I believe you have a surgical room as well.
Right. These are medical exam rooms, so we do have one surgical suite.
Yep.
So we.
Can I borrow somebody's ear? Actually? Can I actually see your soul? If I look into your eye, this is for the eyes or the ears?
I believe that's an ear.
Do I see your brain? Can you see through the other side?
So even though it's all run by volunteers, you've still got state-of-the-art equipment?
Yes, and we do have some folks on staff, so we're not completely.
Oh, no, that's right. Yes, that's correct.
But we're
Reliant.
very reliant on volunteers.
Yes.
We have 30 active volunteers. We could not do this without them.
Yep.
And you have an airbrush artist over here as well.
We do. She's amazing.
Who also happens to be the director of this
Director
facility.
as well, is that right? I'm sorry, my name's
Yes.
Randy. How are you? Okay. I still need some airbrushing done on my car.
Oh.
If you're available
I haven't done any airbrushing in a while.
in a while. So tell me about.
This place keeps me pretty busy
So you've been with us for a long time, and I was.
from the very beginning.
Is that right?
Yes,
Is that
and we have
1845 or?
And how many years have you
this feels
been
close to it. We opened in 1999, and we developed it. It took us a couple of years to organize and develop it. So,
And prior to that, people just couldn't get health care.
that's correct. They didn't have access if they were uninsured. It was difficult to find any access to care.
So do you roll up your sleeves and get in there and do a few surgery operations yourself?
I am not a medical person. I'm what they would call the pencil pusher.
So do you want to actually get some surgery?
No.
You're going to leave that to the professionals who
no
are trained for it.
This is not a secret desire to throw some scrubs on and, away you go? No?
And did you come up with the idea of
I did
bringing
not.
this facility
We
here?
have two founders, Dr. Eileen Reese and Sue Ellen Riddle. And unfortunately, Dr. Reese has passed away. Sue Ellen is quite a frequent visitor here and is as a board member, continuing to work.
And what a legacy to leave behind.
The spirit of both of them is here all the time. And that's one of giving and taking care of others who don't have, who need it.
Fabulous work.
Yes.
I'm curious. I really am. You ever notice with a snowman there's never any eyebrows? Now with you being an airbrush artist,
I could add some eyebrows.
we're going to add some eyebrows. I think that can happen.
Yeah.
All right.
Or even a magic marker would do.
I think that'll work as well. How about is there a doctor in the house?
There may well be.
Doctor.
In a medical clinic, I would expect one.
All right. Then how about we go find a doctor and then we can see what he's all about.
Okay, let's do
All
that.
right.
Can we use that word?
That was it.
So, this is a doctor. Hi, a doctor. How are you, doctor?
There is a doctor in the house.
And what's your name, sorry?
Richard Dew.
Dew, Dr. Dew.
Yeah, like Mountain Dew.
Like Mountain Dew, like
Right.
Dr. Stone. Is there a nurse Stone?
Huh?
Is there a nurse Stone? Do you,
No.
but do you always do or sometimes do you don't?
Just Mountain Dew.
Just Mountain Dew.
Just Mountain
Just
Dew.
Mountain
Don't
Dew.
own
Yeah.
stock.
How often are you here, Dr. Drew?
I'm here 2 days a week.
2 days a week? Yeah. That's
And-
fabulous work that you
And
do.
you're a doctor.
I'm
You're not-
family practitioner.
So you're not a pretend doctor.
No, board certified.
Right. So if I put on that coat and I look like a doctor, could I be a doctor?
Probably not.
So what do you do here? Tell me.
I'm the medical director for the whole clinic, and then I see patients, and on Mondays we have medical students come in and I help teach them.
Oh, is that right?
Oh, it's fantastic. And you've got a surgical room here too?
Yeah, this is the surgical
Oh, this
room
is
right
the surgical
here.
room
Yeah.
right here?
Right, I
Okay.
do most of the surgery that we do here.
Yep, so somebody, if they need a mole cut out or
we do
just
lumps and bumps.
lumps and bumps.
Yeah, it's remove little cyst,
Do you get to take
take
these?
off skin cancers.
Yep.
Do you get to take these gloves on?
No blow up balloons with the gloves.
I was going to make a turkey. It's Thanksgiving.
And we also take off little skin lesions,
Yep.
skin tags and stuff like that. And then like this afternoon, I have a person coming in who has carpal tunnel syndrome, so I'm going to check their.
And you can actually do that all here on site, so they don't have to be on
Right.
referred
Well,
to.
you're right. It's the little skin cancers. It costs $140 to get inside the door at the dermatologist,
Yes.
and so we remove them for $30.
It's crazy.
That is
yeah,
good. And that's actually quite a life-saving thing, too.
Yeah.
Actually, our Karen, your father died of melanoma.
Yeah.
That's right. Yep, so I can
Yeah.
appreciate you need to have those taken care of.
That's it,
Yeah.
so get on to him quick. I've actually had a few cut off as well. So,
He has a few war wounds.
Okay.
Well, we appreciate the work that you do here, and
Right.
it's lovely to meet you.
so tell me, what's the strangest person you've ever worked on? Somebody walked in off the streets, he had like 2 heads or something. Have you ever had one of those?
I've had some strange people.
I had a pimple one time. It was like a second. That was nasty. I'm telling you, I'm glad that.
Well, I give you an example of
Yeah.
what we deal with here a lot. Is I had a fella come here, his family brought him in, and he had a skin cancer right here.
Is that right?
That was about the size of my thumbnail,
Oh.
and it was just almost into his tear duct.
Oh no.
Ah.
And they had taken him to their doctor, and he said, I can't take her to the dermatologist. We can't do it. You got to see a plastic surgeon. And so they called several plastic surgeons and said, the first visit's $500, then we decide if we need to do anything.
Whoa.
And I might as well told him you need to buy a Lexus to drive over here.
That's
in.
right.
Uh,
So what you're doing
so he
here
just
is
sat there and let it grow. And so
Yeah.
finally, he came in and I said, well, don't know if we can do it or not, but got to working on it and had him come back in 3 months, and he had one tiny little recurrence, and we got that off. And now, if you see him, you can't even tell we ever did it.
Right.
Because of your wonderful
No.
work.
So he actually did have a second head on his.
If we'd waited a whole lot longer, he'd have one eye.
Oh,
That's right.
Oh,
Or he could have
that
lost
was-
his life. So what you're doing here is life saving
Yeah.
for people that can't afford medical
Right.
care.
And they don't
Yeah.
have insurance. No, that's amazing. I appreciate your service.
Thank you.
Okay, really do. And I did.
How many office staff do you have in here generally?
Generally, we have 3 folks up front as receptionists. They schedule appointments, they help clients check out, they kind of get a synopsis of what's going on at the beginning.
Yep.
So that's great. And Jim here is a volunteer.
So do they call in? So they say, hello, I want to make an appointment? How does it work?
If someone calls in to make an appointment, we actually only take 2 new patients a day, so we have to say no an awful lot.
Oh, is that
But
right?
if someone is established, then we can go ahead and make them an appointment. If they happen to be one of the first 2 callers, we
Yep.
can make an appointment.
Yep.
Otherwise, very many times we have to say, please call back tomorrow.
So they don't go on a waiting list then?
There's just no way to take care of
to make
waiting
it work.
lists. We have, like I said, over 22,000 patients of record. We still say no over 700 times some months.
So it gives you an idea of just
Yeah.
how important the work is.
It
here
is.
that you
Well,
do.
I really think this is a tremendous service that you offer the community, really. And I think more people should support it.
Thank you.
Yes, absolutely.
And I will say, we have amazing folks who do support us,
Yeah.
and we appreciate them greatly.
Well, listen, being a traveler myself, who's just come to here from Australia, I don't have any medical insurance, so I think
No,
I'm going to have to
that's
talk to the doctor and get a script filled right now. I think I'll do that. I could do that, right? I could, because I
You
don't
have to be one of those first 2
You have to be one of those
callers.
first 2 callers, Randy.
Hello? Can you book me in? I'm here already.
I will say this, a couple of times a year, we use our students to do a free health fair. And we see about 100 patients over a 2-day period. And when folks come in as new patients on those 2 days, then they become established, and it's much easier to get them in for health care.
Okay. Well, this is fabulous. This is one of the best spots, I think, that you're going to find anywhere in the state of Tennessee.
Absolutely.
Thank you so
Thank
much for having
you.
us in. Okay, really
Appreciate you guys.
You do a wonderful job.
Thank you.